right, blessings everyone. I'm just going to get right into this. This is, again, was given to me by a sister or from a sister yesterday afternoon, so I'm trying to get what I can out. There's just a few things that I'm going to be pointing out here, but I really do suggest that you at least look into it, be aware of what is happening here and the severity of it, because this is a true warning. Okay, this is nothing but warnings going out. Okay. During the 1950s, the United States conducted a series of field tests using atomical weapons, EW. Operation Big Itch in 1954 was designed to test munitions loaded with uninfected fleas. In May 1955, over 300,000 uninfected mosquitoes were dropped over the parts of the United States of Georgia to determine if the airdropped mosquitoes could survive to take meals from humans. The mosquito tests were known as Operation Big Buzz. The U.S. engaged in at least 2 other EW testing programs, Operation Dropkick Operation Mayday. Operation Big Buzz. Okay, mosquito teen deterrent. Okay, mosquito. Now you got to remember, now this is a weapon that was a weapon that would disperse crowds. Okay, now is given into the hands of the ignorant, who just now slap it on their homes or their businesses. Okay, so now it's for a group that is only affects a group under the age of 26. So this is our youth. So you could be walking down the street and your 15-year-old child or your 16-year-old all of a sudden is getting zapped in their ear and they're feeling pain. This is what's happening, right? Watering things down. What was once a military weapon is now in the hands of the ignorant. And it only affects a group. And that is our youth under the age of 26.
This device is called the Mosquito. It may look like a security light, but it's a lot more inventive than that. It's designed by a British company to ward off gangs of kids who hang around outside shops, generally making a nuisance of themselves. And it does so by emitting an ultra-high frequency sound that is painful to anyone under the age of 25. It's similar to the non-lethal sound weapons used by the US Army in Iraq to combat rioters, and incredibly, it's designed to only affect people under 25. I wonder. On the left we have the girls. They're both 24. And on the right we have the boys. They're both the other side of 25. In theory, the girls should be susceptible to the mosquito, and the boys shouldn't. So, let's find out. Now, we should warn you that those of you at home under 25 will be able to hear this through your TV speakers, and it might be uncomfortable. So if you don't fancy it, run away now. Have they gone? Good. Then we can begin. Those of you blessed with youth who are watching at home should be able to hear this right now. Our youthful gadgeteers certainly can.
It's extremely high-pitched, very, very, very high-pitched noise.
It's just really squeaky. It's like a irritating, piercing, your brain type sound.
I can't hear it. Can you hear anything?
Can't hear a thing.
You're older than me.
Oh, well, there we go.
Can we turn it off now, please?
It works by emitting a high-pitched ultrasonic tone that is really unpleasant to anyone that hears it. brilliantly, due to natural hearing deterioration, the frequency is one that most people over 25 can't actually hear anymore. So it should just target the young tearaways.
Makes me just want to run away.
Oh God, get
So
real.
you need a sonic weapon to defend
But
yourself.
you don't know when it's going to happen again. You don't know if the incidents are going to escalate. You don't know if they might try and break in 5 years' time, because no one is putting the brakes on their behaviour. And it's not their fault, it's the parents' fault. But if the parents aren't doing anything about it, I totally
But do you think
sympathise
this
with them.
teaches a good lesson? I mean, if the way that you fight this then is to go, right, okay, here's a great lesson. So the parents aren't dealing with their behaviour, so I know what I'm going to do. I'm going to show them the best way to deal with this is to do something that's going to hurt them. That's a good lesson, isn't it?
We're living in a society where we are putting kids at the focus of society, and it's, everyone else, you're second place to our children. And that isn't a good message, isn't a good message for the future or for society, I don't think.
Well, in case anybody doesn't know what it actually sounds like, we obviously the noise that we're talking about is audible only to certain generation, to youngsters. So we've ranked it up so that everyone can hear it. So this is in our audible hearing range, and that's what it sounds like.
I mean, that is.
So if you change that,
horrible,
you
isn't it?
change the pitch, and gradually it disappears to us. We can't hear it because we're too old, and you can only hear it if you are a child. Right, we can stop that now. Thank you very much, Tim.
Okay. In 1953, the AEC ran several studies at the University of Iowa on the health effects of radioactive iodine in newborns and pregnant women. In one study, researchers gave pregnant women from 100 to 200 micro 3.7 to 7.4 MB of iodine 131 in order to study the woman's aborted embryos in attempt to discover at what stage and to what extent radioactive iodine crosses the placenta barrier. In another study, they gave 25 newborn babies who were under 36 hours old and weighed from 5.5 to 8.5 pounds iodine 131, either by oral administration or through an injection, so that they could measure the amount of iodine in their thyroid glands, as iodine would go to the gland. In another AEC study, researchers at the University of Nebraska College of Medicine fed iodine 131 to 28 healthy infants through the gastric tube to test the concentration of iodine in the infant's thyroid glands. In 1953, the AEC sponsored a study to discover if radioactive iodine affected premature babies differently from full-term babies. In the experiment research from Harper Hospital in Detroit, administered iodine 131 to 65 premature and full-term infants who weighed from 2.1 to 5.5 pounds. In 1955 to 1960, Samoya, I can't pronounce it, State Hospital in North California served as a permanent drop-off location for medical disabled children diagnosed with cerebral palsy or lesser disorders. The children subsequently underwent painful experiments without adult consent. Many were given spinal taps for which they received no direct benefit. Reports of the 60 Minutes learned that these 5 years, the brain of every child with cerebral palsy who died at Sonoma State was removed and studied without parental consent, according to the CBS story. Over 1,400 patients died at the clinic. Immediately after World War II, researchers of Vanderbilt University gave 829 pregnant mothers in Tennessee what they were told were vitamin drinks that would improve the health of their babies. The mixtures contained radioactive iron, and the researchers were determining how fast the radioscope crossed into the placenta. At least 3 children are known to have died from the experiments, from cancers and leukemia. 4 of the women's babies died from cancer as a result of the experiment, and the women experienced rashes, bruises, insomnia, hair tooth loss, and cancer. From 1942 to 1944, the U.S. Chemical Warfare Service conducted experiments which exposed thousands of U.S. military personnel to mustard gas in order to test the effectiveness of gas masks and protective clothing. So they, at all costs, From 1950 through 1953, the U.S. Army conducted Operation LAC, Large Area Coverage, spraying chemicals over 6 cities in the United States and Canada in order to test dispersal patterns of chemical weapons. Army records stated that the chemicals which were sprayed on the city of Winnipeg, Manitoba, Canada, included zinc, cardium sulfide, which was not thought to be harmful. A 1997 study by the U.S. National Research Council found that it was sprayed at levels so low that as not to be harmful. It said that people were normally exposed to higher levels in the urban environments. In 1953, the CIA placed several of its interrogation and mind control programs under the direction of a single program, known by the code name MKUltra. After CIA Director Alan Dulles complained about not having enough human guinea pigs to try these extraordinary techniques, the MKUltra project was under the direct command of Dr. Sidney and of the Technical Service Division. The project received over 25 million and involved hundreds of experiments on human subjects at 80 different institutions. In 1954, the CIA project QK Hilltop was created to study Chinese brainwashing techniques and to develop effective methods of interrogation. Most of the early studies are believed to have been performed by the Cornell University Medical School Human Equitable Studies programs. Cornell, that's just not too far. Under the direction of Dr. Harold Wolff. Interesting, isn't it? Wolff requested that the CIA provide him any information they could find regarding threats, imprisonment, deprivation, humiliation, torture, brainwash, and best of all, black psychiatry and hypnosis, or any other combination of these with or without chemical agents, according to Wolff, the research team. Okay. After another of the MK sub-projects, that's not the one right there. Okay, here it is. This is important. This is very important. This is all about the re-education. In 1957, with funding from the CIA from organizations Don Arrow and Carmen of the Allen Memorial Institute in Montreal, Canada, Quebec, Canada, began MKUltra Sub-Project 68. His experiments were designed to first depattern individuals, erasing their memory and their minds and memories, reducing them to the mental level of an infant. This is your trauma, the triggers, right? As a youth. And then to rebuild their personality in a manner of his choosing. To achieve this, Cameron placed patients under his care into drug-induced comas for up to 88 days and applied numerous high-voltage electric shock to them over the course of weeks or months, often administering up to 360 shocks per person. He would then perform what he called psychic driving experiments on the subjects, where he would repetitively play recorded statements such as, "You are a good wife and a mother and people enjoy your company," through speakers he had implanted into blacked out football helmets that he bound to the heads of his test subjects for sensory deprivation purposes. The patients could do nothing but listen to this message playing for 16 to 20 hours a day for weeks at a time. In one case, Cameron forced a person to listen to a message nonstop for 101 days.